And then I wanted to talk a little bit about the NUNM residency and why would you apply to an NUNM residency versus one of the private clinic sites? It depends on what you're looking for. I am not here to sell you that NUNM is the right residency for everyone, because it isn't the right residency for everyone. But if you really like teaching and staying up to date on all the stuff that's coming out, and looking for mentorship from all kinds of different docs that you work with, and being part of a great team, it's a definitely a different type of residency. It's very team based. It's very teaching based. You know, supporting students, helping them cross the threshold that you've just crossed. You know, our NUNM residents see more patients in their very first quarter as first year residents than you will see as a student your entire career here. So if you get an idea what that number of patient contacts and experience is like, it's far greater than what a private site can offer as well. So it's certainly an accelerated, immersive experience. And I wanted to turn it over to two of our current residents, PGY2s, Dr. Bonesley and Dr. Bohem, to maybe share some of your thoughts. Feel free to share both pros and cons. Really, it's not about telling everyone that this is the best site for them. It's just telling them what to expect so they can decide if it's the best site for them. And I'm going to turn it over to you two.
Great, thanks, Dee. Like I said, I'm Dr. Bonesley. I think I know all y'all, but and I agree. I'm not surprised to see these faces appear to this morning. Um, I graduated from NUNM. I really wanted to do an NUNM residency because I love to teach. And I was super pumped. I was like, yeah, I'm going to teach. I'm going to be so great. And I am going to just start with a con, because the pro is that you get a lot of teaching, which is awesome. But the con is that you get a lot of teaching. You are basically practicing medicine through students, which is awesome. You learn so much from your students, but at the same time, you do also, especially as a first year resident, you do not get as much of the like taking a history, like talking to your patients, being the first one in the room kind of experience. So that is a little bit of a downside, but honestly, I think that I'm learning a lot more in this residency. Um, the pros are that you see a ton of patients. I remember tracking my patient contacts and being like, oh my gosh, I saw 250 patients my first term. So it's a lot of just experience. You see a lot of variety. I also really loved that I got to work with so many different docs. I was working with doctors I never really got to work with as students, which was really awesome. Um, and it really helped me now that I'm in my second year and kind of in that attending role. It helped me decide what kind of doctor I'm going to be because I saw things I wanted to emulate and things that I didn't. And you kind of see that as a student, but you have no idea what goes on behind the scenes. And as a resident, you really get to see the doctor's thought processes, and you are more of like you're almost more of like a peer to your attendings than just a student. And so you really get more of a hands-on and a more of a, I guess, insight into their thoughts. And yeah, I don't think this residency is for everyone. I think you really do, especially the NUNM residency. I don't think if you're not into teaching and if you're not into like being kind of, I would say you're not the center of attention, but you do have a lot of eyes looking at you a lot of the time, being like, tell me, Dr. Bonesley. And I'm like, I gotta look it up, or you can look it up. um, and yeah, I think that's kind of been my experience and what I think you can expect from a residency here. Um, I just want to reiterate getting the faculty evals for your applications in ASAP. I asked, I think in October or November, and I finally got them all in on the deadline. So I would just say, yeah, make sure that you start getting this all together as soon as you possibly can. And then there was like a drama with my transcript. So I would just say, yeah, try to get that on and going as soon as you can. Um, Yeah, I think I do really recommend residency just in general because I am so thankful that the minute I walked out with my diploma, I didn't have to go teach like practice. Because even as a second year, I'm like, oh my gosh, I have a million questions. Dr. Saunders, Dr. Galani, Dr. Ortiz. Like, I ask all my mentors all the time. And I think that having the opportunity to be under such amazing docs right out of the gate has really been helpful because now, as a second year resident, I feel very comfortable texting these doctors and being like, hey, I have a question. And I think as a student, you don't really get that like really personal relationship that you develop with these doctors later on. And it's a huge benefit, I think, in the long term. And it will really help me even when I leave NUNM to have this network that I can always rely on. So
Thank you. You
that's
also
my
get to
spiel.
you get to learn emergency medicine.
Yeah,
You
occasionally
get
you'll
to
have
be
a
the
patient. Yeah, my patient who went into respiratory distress in the waiting room. So it's very exciting.
awesome.
And the fact that I wasn't the only doctor, we're in a clinic, and so I just yelled at Samuel, "Get me another." Well, I said, "Get me a doctor," to which he sassily responded, "You're the doctor. I'll go get another one."
It's always great to have a team around. Dr. Bohem?
Yeah, can you hear me okay? I don't know where my
Yes.
microphone is. Okay, cool. Like, do I need to go up here or down there? I won't belabor some of the points that Dr. Bonesley went over. I agree with most of them. One of the things that I was very excited in the first year to kind of take a step back, it was nice to just kind of sit and listen to the students and listen to the attendings. And I'll second what Dr. Bonesley said about that kind of giving me a lot of input about how I wanted to practice. And I felt very comfortable taking that back seat for most of that first year. And then the way that the NUNM residency is designed is that you'll never have to be the attending until you've been in the job for 6 months. So once you're 6 months in, then you may sub as an attending, which is a really nice stepping stone into being like attending more frequently. Because then you get to practice, okay, this week Dr. Galani's out, so I'm going to be attending, and I'm really scared, but it's going to be fine because I don't have to do it every week. So that was a really nice stepping stone. And then the timeline worked out really great for me because by the end of my first year, I was like, okay, I feel ready. Like, I can do this. I still have this team around me. I'm not alone, but I feel like I can lead people now, as opposed to the first year. I was really just trying to soak everything in. So I think that's a nice aspect of the NUNM residency in general. Something that Dr. Bonesley didn't touch on is like the work-life balance of a residency. I have this conversation a lot with students who are usually their mind is going, okay, do I join this practice who has offered me a lot of money, but I know I'm going to be working X amount of hours a week? Do I join this private residency who may be offering a little tiny bit more money, but I'm probably going to be working double the hours of an NUNM residency? Or do I pick the NUNM residency knowing exactly how many hours you typically work a week? And it usually only changes based on if you get called in or not. But if you work those days as if knowing they are your working days, your hours don't change that much week to week. I can say I have friends who have done all 3 routes, and by far I have the best work-life balance. And I appreciate that because it keeps my mental health in a very happy, positive place. And I think that's really important and something that we don't talk about enough in this field of like taking care of yourself and leaving your work and going for a hike and going to yoga or whatever, like spending time with friends, whatever it is that is outside of work. You should have a life outside of work. Personally, I know that there are some people who probably work to live or live to work, you know, those two phrases or sayings. I love my job, but I love it because it is not my entire life. It's something that I can go do and I enjoy, and I get to make money and then I get to have a life outside of it as well. And I can't say that for a lot of people who I know in different residencies. At least the first year, it can be really, really rough the first year to have maybe 2 or 3 weeks of a like orientation, and then you are attending. From there, you are seeing all of your own patients right out the gate, and you're closing all of your charts by yourself. And it's a lot. It's very valuable in very different ways, right? Because right now, as a second-year resident, I'm relearning how to take a history and do a physical exam and do everything by myself, which I'm really thankful for. But I'm thankful that it came in the second year for me as opposed to the first, which is going to be different for everybody. But that's kind of my take on it and why I personally like the NUNM residency and the way that it's set up. And
thank you, Dr. Bohem. I appreciate that. Certainly, at first year, let me give a structure. First year residents at NUNM do practice medicine through students, like Dr. Bonesley said. What does that mean? It means the fantastical game of telephone, and then your brain has to be on double time to make sure that you're not falling prey to framing bias. When a student comes out of the room and they report you maybe only 70% of what they thought was important, but they didn't think the other 20% was important, and they didn't say a very key piece. We need to actually be thinking about all of the things and not just zero in on what the student is thinking. That's called framing bias. And so it's actually more mental gymnastics. It's more learning because we have to ensure the safety of everything. So we might have to walk back in the room and ask all the red flags and make sure that our spidey senses aren't coming up, that maybe something more acute is happening or something along those lines. And then, so the first year residents, they have five-hour shifts, five-hour shifts. So you're in clinic 25 hours a week, guaranteed. And then you have 2 on-call shifts where you may get called in 5 or 10 more hours. It rarely happens twice every week over and over. It doesn't. There might be some bad rashes that come around where you feel like you're getting called in a lot, and then other times you're not. So that's a first year schedule, 5 shifts, 2 on-call shifts. And then there are other opportunities to do some of our externships. Every first year rotates through our lab so that you learn not just to keep your phlebotomy skills up, but how to process blood work and send it out, just some of those back of the house pieces that are really important. And then first years also get to participate in some academics by proctoring structure and function labs or finals or other physical exam things. And then they get to be a little bit involved in OSCEs and OSCE 1 only. And then a second year of residency at NUNM, speaking to what Dr. Bohem was saying, you get a private shift where it's all you just by yourself, taking the history, physical exam, treatment, and everything. So now you're refining those skills. And you also have an attending shift with students. And then you do have 2 resident shifts where you're still working under the tutelage of maybe 2 more mentors that you wanted to work with. And then you have 2 on-call shifts. So that's sort of the structure, and third year is a little bit similar to that. Certainly, it is a great teaching environment, and it's a great team. I'm surprised neither one of you mentioned your team, but you guys are like always on texty, supporting each other and all of that. And from what I hear, meeting outside of work and stuff like that. The other piece about work-life balance is because you might have only 5 shifts, it might mean that you have Tuesday morning off and a Friday afternoon off. And these are, times when not everybody else and their mother is at the trailhead and you could be the only one. And versus other private, thanks, Dr. Ponsley, other private residencies fall through a traditional like 8 to 5 Monday through Friday, and some of them also have Saturday requirements. So you get a little bit more traditional and predicted schedule would be a pro of a private residency. And then the academic residency schedule changes twice a year predominantly. You carry the same schedule for 6 months. So you're actually able to see the patients on all of those shifts over a 6-month period of time. So you get a little more follow through. And then it changes over, so you have one more opportunity to work with a different batch of folks and see stuff. And you'll get to learn to manage something like diabetes based on we have a naturopathic toolkit is like our Mary Poppins bag where you can pull out a lampshade and an umbrella. We have so many different things, and it's great to see different doctors wielding different tools in our bag for the same condition. So when I was a resident, I remember working with a couple of different docs and watching their approach to diabetes, and it was all safe, but all very different and in their approach. And I was able to take pieces of what I was seeing and actually turn into the practitioner of how I wield our toolkit now. It is really highly shaped from my years in residency at NUNM. So I wanted to share that as well. It looks like we have 15 minutes left for Q&A. I will just say that if you didn't already log in and get access to our website, the ANMC portal, make sure you do go to the resources tab in the library and download all that fun stuff. And then make an appointment with Noelle or myself to chat more. There is nothing else you can do to prepare really so much. For some people say, I want an NUNM residency. What can I do to make myself look good? We take people that have all kinds of different strengths, and that's what makes our team good. So some of our folks have done a lot of TAing. Some of our folks maybe have been more involved with some research. Other folks might have had a job as a front desk in at an ND office, for their 3 or 4 years. Different experiences bring different strengths and skill sets. So while you will be evaluated for leadership skills, so like some people did a lot of SGA or NMSA, but they didn't do a lot of research or teaching, all of this is okay. What we are looking for is that you've applied yourself to something strongly, and that you can, contribute to the team with some of the experience that you do have that you can bring in. So you don't have to have it all. That's a common misconception. And there's nothing that you can really do to like, flesh out your CV, to make yourself look better. Just be yourself. And I think everything will work out fine. Okay, great. Let's do Q&A.